The topic of this presentation is the effects of alcohol on families, presented by Sherry Christopherson, Thitnu Dirksen, Merlin Francis, and Janice Small. Alcohol statistics: slightly more than half of Americans aged 12 or older reported being current drinkers of alcohol. According to the CDC, Centers for Disease Control, alcohol causes 88,000 deaths per year, and according to SAMHSA, Substance Abuse and Mental Health Services, report from 2012, about 24% of 8th graders and 64% of 12th graders used alcohol in the past. Further statistics, according to SAMHSA and the National Survey on Drug Use and Health in 2013, there were 136.9 million current alcohol users aged 12 or older, with 22.9% classified as binge drinkers and 6.3% as heavy drinkers. About 17.3 million of these, or 6.6%, met criteria for an alcohol use disorder in the past year. Unfortunately, only 7.7% of all adults with alcohol use disorder received treatment in the past year. SAMHSA defined excessive alcohol use as drinking 5 or more drinks on a single occasion for men, or 4 or more drinks on an occasion for women. This can increase a person's risk of developing serious health problems, including brain and liver damage, heart disease, hypertension, and fetal damage. The effects of alcoholism on families can cause more damage and pain than any other influence on the entire family, whether it be internal or external. The impact of the drinker's abuse or addiction is usually manifested differently with each member of the family and has long-term effects, negative implications, according to Corte and Bircher 2007. Women and alcohol: according to the CDC, 50% of women of childbearing age, 18 to 44 years old, use alcohol. Gender differences such as body structure and chemistry make women to absorb alcohol and allow them to metabolize alcohol longer in the body. This makes women more vulnerable to adverse long-term alcohol effects. We'll focus on the women and children for the next few slides of this presentation. Continuing with women and alcohol, according to the CDC, 7.7% of pregnant women use alcohol. Women who drink alcohol while pregnant put the child at risk for getting fetal alcohol syndrome and sudden infant death syndrome. Some of the physical effects obvious would be liver disease. The risk of cirrhosis and other alcohol-related disease is higher in women than for men. The impact on the brain related to excessive drinking may result in memory loss and shrinkage of the brain. Further research suggests that women are more vulnerable than men to brain damage and effects of excessive alcohol use, and the damage tends to appear with shorter periods of excessive drinking for women than for men. Impact on the heart: studies have shown that women who drink excessively are at increased risk for damage of the heart muscle than men, even for women drinking at lower levels. Cancer: alcohol consumption increases the risk of cancer of the mouth, throat, esophagus, liver, colon, and breast among women. The risk of breast cancer increases as alcohol use increases. Sexual assault: binge drinking is a risk factor for sexual assault, especially among young women in college settings. Each year, about 1 in 20 college women are sexually assaulted. Research suggests that there is an increase in the incidence of rape or sexual assault when both the attacker and the victim have used alcohol prior to the attack. Children and alcohol: 28 to 34 million children and adults in the United States today have addicted parents. Physical problems such as asthma, hypertension, gastrointestinal disorders, abdominal pain, headaches, and tics. Emotional problems such as low self-esteem, depression, suicidal thoughts, eating disorders, substance abuse or dependence. Social and school problems: related to antisocial behaviors, delinquency, running away, and social isolation. This is according to Gantz Cleveland 2006 article. The illustration of the problem, we have scenario number 1. Andrea is a 32-year-old divorced woman, lives with her 11-year-old son, Christopher. She works as a full-time dental hygienist and resides in Brewer, Maine. During the physical exam, she mentions that she drinks approximately 1 bottle of red wine almost every night since the divorce 6 months ago. Scenario number 2, which is Joyce, 24-year-old, who is 4 months pregnant. She comes in for her first prenatal visit with her boyfriend for the past 3 years, and his name is Howard. During the appointment, Howard expresses his concern of Joyce's excessive drinking habits and worries about the health of the unborn child. Joyce admits to drinking 1 to 2 drinks almost every day when she comes home from work to unwind from the stress of her job, and this habit has continued despite her pregnancy. The importance of this issue related to family nurse practitioners is that alcoholism affects everyone. As family nurse practitioners, we are taking care of the whole family. That includes the alcoholic, children, and other family members and friends. According to Estes and Hansen, the malignant effects of alcoholism are felt not only by the victim, but the close family members as well. In some ways, 50 million Americans lives are influenced by alcoholism. Every nurse practitioner can expect the frequent contact with persons who are directly or indirectly affected by alcoholism. The 2 questions I pose to the group is, who does alcohol hurt? Answer, everyone. Where does alcohol hurt? Answer, everywhere. The current state of knowledge, which is a literature review. In conducting the literature review, we first analyzed how hereditary and environmental factors play a part in onset of alcoholism in females. Then we looked at how the role of parental alcoholism plays in the developmental of child's parentification. Finally, we looked at the factors contributing to achieving sobriety in the family unit. The literature review involved 4 articles, which are listed on the screen. The first study, which is a study of twins related to the Swedish Twin Registry, which involved 24,119 participants aged 20 to 47 years of old, answered the questions to assess the role of genetic and environmental factors in female alcoholism, with possible differences between early and late onset disease types. We'll talk about type 1 and type 2. Type 2 is characterized by early onset, antisocial behavior, and a higher degree of heritability, and is more common in males. Type 1 is described as having a later onset compared to type 2 in relation to the female population, unless abuse or neglect was involved in that childhood. Early onset of alcoholism has been defined as heavy drinking manifestations before the age of 20 years of old. The findings indicate that heritability for alcohol dependence was 55% and did not differ significantly between men and women, although women had a significantly greater heritability for late onset type 1 alcoholism. Childhood physical trauma and sexual abuse had a stronger association with early onset compared to late onset alcoholism in females in relation to this study. The next study, which involved family unpredictability, parental alcoholism, and development of parentification. Parentification is the role reversal within the parent-child relationship where the child acts as a parent to their own parent. Parentified children may be enlisted to care for their parents' physical, emotional, and even financial needs. This was a research study under family unpredictability, parental alcoholism, and development of parentification. Within the study, participants, which was 123, from 10 outpatient clinics, completed surveys that included the retrospective family unpredictability scale, the Children of Alcoholics screen and test, and the parentification questionnaire. The results indicated that familial unpredictability and parental alcoholism each emerged as significant and independent predictors of parentification in the child. For this clinical population, female children were more likely to be enlisted in caretaking roles in their families of origin.